All right, so my name is Jennifer Martinez. I am going to be working with you for the next 12 weeks while we go through this wonderful course, Transition to Practice, Mastery of Concepts. Um, so this is one of the newer courses. Have you enjoyed the new curriculum so far? Have you enjoyed it? And if it's nursing school, is that what you're saying? Okay. Um, so I've been with Fortis for about almost 5.5 years now, in various capacities. I was on campus and then I moved to San Antonio, Texas. There is not a Fortis in San Antonio, so I transitioned to online last year. So I've been online with Fortis for a year now, teaching leadership, community, Gero, so a couple of different classes. Let's see. I'm just looking at, all right, so the last person that logged in, it says Zoom user. I might want to change your name on there so that we know who you are. And then Martha, can you put your last name on there for me? Where is she? Thank you. And so what we're going to do today, first we're going to do the orientation PowerPoint, and then we have a couple chapters that we need to go through the syllabus, do all that wonderful stuff. So before we get started, does anybody have any questions? No. All right. Um, all right. So one thing that I will ask you to do while you are listening to me, if you could please, in the chat, put what campus you are from, in the chat. That would be fantastic. This way I can have that information. Thank you, Tiffany. Um, all right. Columbus, Norfolk. All right. Cool. All right. So I am going to share my screen, and we will run through this orientation PowerPoint. I'm going to share. All right. I know you guys have seen the orientation before, and it's always part of, that first week of class. So again, welcome to PNR 152. Congratulations, you're at the end of your programs. Everybody a little bit excited about that? All right. So we know what online learning is, right? It's using your computer, it's using the internet to participate in your program. Um, I will, obviously going to interact with you throughout the course. We have our weekly Zoom meetings on Monday mornings from 9 to, oh, what is it? 11:57, I believe. Um, and so I'm here to provide guidance. I'm going to, lead the learning activities. I will give you food feedback about your progress. You will have weekly homework assignments and learning activities, your quizzes, your tests, or your exams. And so you will be required to complete your coursework every week. And one of the really cool things about working or having online classes is you do get to meet students from other Fortis campuses in other states. So that's pretty cool. For any issues, computer access, course questions, grading concerns, all of that, just please start with me. Um, Sorry, I'm trying to answer chats too. Um, and so the contact information, so you can go to about your instructor in your Canvas module, and that will give you all my information. So you'll have my office hours, you have my phone number, you have my email address. You can message me via email or through Canvas. Or you can call or text. Either one is fine. Um, and then if there's something that I can't help you with, I'll be able to direct you to, somebody that can. So again, I will be your first contact. If I can't answer your question or you need to talk to somebody else, Dr. Tenza is the course lead for 152. And then, of course, the online dean is Dr. Darlene Brown, and her contact information is there as well. And then, of course, if you have any concerns about your on-ground courses, then go to your campus instructor and, of course, your campus dean. Oops, hit an extra slide. So communication, just be courteous, positive, respectful. Be mindful of how you express humorous or emotional statements, just because, we know that they can be misinterpreted. Trying to keep our comments related to the discussion. Be considerate of others' experiences, feelings, and perspectives. Making sure that we use proper language and titles, no slang. And then don't type messages in all caps, right? So make sure that you're typing those appropriately as well. Online courses have specific start and end times. So classes are scheduled on specific days with specific start and end. So 0900 is when we start. And I believe it's 11:57 is when we end. These are mandatory class times. So you need to be present for your courses. And then course activities can include projects, lesson activities, adaptive quizzes, or exams. And then due dates are according to the syllabus week, and they are posted in your course shells. All of your assignments already have due dates in them. Um, and then they will open for most of the assignments, they will open the week that they are due. Standards of professional conduct. I need to make this a little bit bigger, just because I'm blind. So academic integrity. All incidences of academic dishonesty and violations of academic integrity will be disciplined, such as cannot be listed exhaustively, but some examples: cheating, plagiarism is a big one, which is submitting the work of another person for credit, or failure to properly cite references for any work which is not original to you. It's also copying the work of others, allowing another student to copy from the student, unauthorized use of notes or materials in exams, including talking to other students, um, forging or altering assignments, unpermitted collaborations, giving or receiving aid on a take-home exam or other academic assignment, allowing others to copy or use work that is not his or her own, and providing answers from graded assignments to others. Sites that promote cheating, and I know you guys have heard this before. So use of these sites does not promote honor, integrity, or ethics, and they are monitoring these sites. So if you are found on those sites, you will be placed on heightened monitoring of your work for academic integrity violations. Don't reference these sites. That will result in a 0 for the assignment. And then a second incident involving these sites will result in course failure. And so it also puts you at risk for being dismissed from the program. Your campus upper administration will be involved. So please try not to use those sites. And that's like your StudyGo, your Coursera, Stuvia. There's a lot more out there. I don't even know any of them. There's like a long list, but if the resource is not in your course cell, my suggestion is that you don't use it. With artificial intelligence, um, so AI may only be used as approved by instructors on selected assignments, and you must disclose all AI use and you must submit their original work along with the AI enhancements when the assignment is submitted for grading. And so you cannot submit only AI generated assignments. The American Nurses Association Code of Ethics serves the following purpose. It is a succinct statement of ethical values, obligations, duties, and professional ideals of nurses individually and collectively. It is the profession's non-negotiable ethical standard, and it is an expression of nursing's own understanding of its commitment to society. So, with that being said, it all comes time to your, looking at the code of conduct and the ethical standards, which is why we don't want you to use those sites. You need to learn the information, understand the information as you move forward, so that when you go to take that NCLEX at the end, you won't have any issues. Um, attendance. Attendance is only recorded during our assigned live session time. So you're here now, you will get attendance for today. I will take attendance. And so to be counted as present in the class, you must sign in with your full names. So if your first name and your last name is not on your Zoom login, then you will not get attendance. You need to be on camera the whole time, not pointing to the ceiling, not pointing to the ground, right? It needs to be on you at all times. Anyone at work, driving, or in a healthcare setting, hospital room, doctor's office will be removed from the session. So you need to be at home and at the school in a classroom, but not working, not anywhere where there's a potential issue with HIPAA. Anyone, again, if you're not on camera, I will message you. I will message you or through the chat. If I do not get a response, I will put you back in the waiting room. And you can message me from the waiting room. But, I understand if you have to go use the restroom, something along those lines, that is okay. Just send me a chat saying, hey, I'll be right back. This way I know that, you are coming back and that you are there. Um, I will verify your time in class by looking at the login logouts on Zoom. So once the Zoom meeting is done, I can pull a report, which will tell me which time you logged in, if you logged out, logged back in, that kind of thing. Any attendance missed will be in 15-minute increments. So if you're 2 minutes late, you're missing 15 minutes class. If you leave 5 minutes early, you miss 15 minutes of class. And then anyone without posting attendance 14 days in a row will be dropped without notification. So for whatever reason, if you don't make it to class for 14 days, you will be dropped from the class. And then, of course, there is no makeup for missed attendance. We talked about that. Students with chronic absenteeism in excess of 20% of the scheduled course or the scheduled hours for a course may receive a failing or reduced grade for the course, and it's usually one letter grade. So do keep that in mind that if you miss any more than 20%, you can drop a full letter grade. Oh, there it is. I put in after every class, I will put attendance in. It also, the online office will post attendance weekly. If you miss at 5%, you'll get an email through Campus View. At 10%, you'll be required to meet with the instructor as well as the dean. And then at 15, you may be required to meet with the campus administration. Just note that not always will you get letters at each one. So just, keep track of your time. If you have questions about your time or you have to miss, please let me know, and I can provide that information to you. Students must be appropriately dressed and groomed, portraying a clean professional appearance, no pajamas, see-through or revealing
They
clothing.
say they
And if the policy is not maintained, we will revert to the campus classroom policy of uniform.
no, you go and then you miss it.
Destiny, can you mute, please? Thank you. Um, Alcohol, tobacco, drug abuse policy. So the inappropriate use of legal substances such as vaping, tobacco, marijuana, and edibles. Alcohol and certain prescribed medications is determined by the dean of nursing is prohibited and will not be tolerated under circumstances. So no vaping, smoking, using tobacco products, including oral tobacco, marijuana while in uniform, including after school activities and while in public. This projects a negative image of a healthcare program. Students are also forbidden from using these products while in their street clothes on campus or at a clinical site. And so virtual classroom as well is to be treated as classroom. So no smoking, no vaping, any of that while you are in class. So be successful. How many of you have already logged into your class and gotten looked around at least for the first module? Yeah. So log in 4 to 5 times a week to stay connected and engaged. Keep in contact with me, please. Um, I will post your course announcements weekly, and we'll also add things here and there as we go. You'll see some math questions pop up. I also have some practice delegation and assignment questions that I'll post for you just to help you practice. But again, just keep an eye on those announcements. Submit all your assignments on the week when they are due. And then, of course, towards the end of the week, you want to review assignments for next week. Biggest thing is not procrastinating. One thing that I'm going to add here too is, excuse me, is keep my Zoom link separate. Whether it's, somewhere, in a Word document, or somewhere handy. So I don't know how many of you remember when Canvas went down last term, it made it a little bit of a mess. So keep my Zoom link handy this way if Canvas does for any change, any particular reason decide to go down again. You have my Zoom link or any instructor's Zoom link, so that you have it available so you don't miss class. So day one, log into Canvas, open your online course, click them to, read the instructor information, look at the contact information, and then of course, print or save the course syllabus, review the course syllabus, and then confirm that you were given the correct textbook and edition. Everybody has access to the textbooks. There was no issues with the textbooks. I didn't get any emails, so I'm assuming everybody was okay with the text. And then if you are missing anything, of course, let me know. So come to class prepared to discuss the concepts. So you're at the end of your programs. So a lot of this information is stuff that should be a review for some of you. Other parts of it, maybe not. But we're give you all the information that you need. Attend additional review sessions. And when I pull up the syllabus cover sheet in a little bit, I will talk to you about my availability. If you have any issues with concepts, I do have office hours posted. I also am available for tutoring should anybody need additional tutoring. And then if there's any technical difficulties like logging in, you want to contact tech support, let me know as well if you're having any issues, then I can see what I can do to help. Your KGAs, so your unit exams and your specialty exams are going to be your KGAs for this course. Your adaptive quizzes, your lesson activities, your group projects, and your professionalism, those are all going to be homework grades. All right, so you want to focus, your KGA focus, I'm sorry, is on your unit exams and your specialty exam. For weeks 1 through 5, homework scores will be turned off. In week 6, I will turn the homework scores on, so that will show you what the impact your homework has on your KGA. And then I will turn homework off again in week 8. And so this again just lets you see where you stand within the course so you can make a decision. And then after week 8, the homework scores will stay off. And then once everybody has completed their HESI and their HESI remediation, then I will turn the homework scores back on. Yes, Tasha.
So our KGA score is not 78%, it's 80%.
No, it's still 78, but it's 80% of your grade.
Oh, okay.
Yep. And then your homework is that other 20%. So your combined score on your unit exams, your specialty exam must be that 78% or above before you get any credit for that homework. If you don't have a 78, then I'm not going to add in that homework grade. For your exams, remember you have to have 2 devices. You have to have your laptop to run the exam and then a phone to be on Zoom. Make sure that both of them are charged or on a charger. If you go off camera while you're in the exam, you will receive a 0 for the exam. So no excuses for that. Please make sure that everything is charged or you have chargers available for you. Remember, no scrap paper is allowed. You need a whiteboard, or you can use a sheet protector and a dry erase marker. And then the board must be erased at the end of the exam. So if you write on the whiteboard, you must erase it as soon as you're done with the exam. Remember, your exams are timed. Um, Exams are scheduled and given through ExamSoft. You'll log in on the second device for Zoom, whether it's your phone, whether it's an iPad, and then you'll sign into ExamSoft, read your exam directions carefully, and then once everybody is ready to get logged in, then we give the code, and you can begin the exam when you are ready. When you are finished, you want to make sure that you click save and upload. And so I'm sure all of you know by now with ExamSoft, a lot of times it'll kick you off the internet. Um, and so when you go to hit submit, you may have to actually reconnect to your Wi-Fi or to your internet in order to upload the exam. Now, with this course, we will have lecture after your exams. All right. So I saw that, Destiny. So yes, we have lecture after the exams, only because it's a 3-hour course, almost 3 hours. Um, but I need to make sure when you submit those exams, do not we will, if you're the first one done, make sure that I, see the green check mark and that I have your exam. Um, this way we can make sure that it gets uploaded appropriately. Exams may not be repeated to improve a grade. So if you have any issue that may impact your performance, talk to me before the exam and not after. So this is huge, okay? I've been in education since 2012 and I cannot stress this enough. You were up all night sick. You were up all night with a baby that was sick or a kid that was sick or there was an emergency or something happened, okay? And then you come in and you take the exam and you do really bad. And then afterwards you say, okay, well, Miss Martinez, I was up all night with my child that was sick. I can't help you. If you tell me before the exam, hey, Miss Martinez, I was up all night. I was sick. My child was sick. I don't know, such and such happened, whatever it is. Okay, I can help you then. I can't help you after. So please, if there's any issues that may potentially affect you from doing well on an exam, please let me know before the exam, not after the exam. If you have accommodations, okay, please let me know. Send me an email with the accommodations. Just because if you had accommodations last term doesn't mean that I know about it. All right. So please, if you have accommodations, you need to let me know. Any notifications less than 10 days before an exam may not be able to be granted in time. Okay. There is a process that we need to follow. Exams are held during scheduled class time. Okay. The only exceptions there are with written approval by faculty member and copied to the national online dean. Okay. So, like I said, you were up all night with a child that was sick, or you were sick or something. Okay. As long as it's within that 7 days, I can help you. Exams can only be proctored with a faculty member on campus with 72-hour notice and must still be done during the scheduled class time. So if you know that your internet at home sometimes is a little sketchy, or you're having some, you prefer to take your tests on campus, I need 72-hour notice. I also need to know who the faculty member is that will be giving the exam, and it still needs to be taken during the scheduled class time. Again, this is that more about the exam. We know that the exams are Zoom proctored, so you have to be on camera the entire time with a profile view and face fully visible. Okay. So you have to have that second device. You will show your photo ID. Any failure to show a photo ID or not be fully visible at any point may result in exam or course failure. You have to show your complete testing environment. So I need a 360 view of the testing area, including your desktop, your walls, the sides of your computer, the chair, the floor, under your desk, all of that stuff. If your ears are covered, and show me if there's just making sure that there's nothing in your ears. If you have a religious exemption, we can discuss that separately. Do not assume instructors know everybody's requirements. Missed exams will be held to the late work policy. Exams missed without prior notice will be a 0. All right. So if you just decide not to show up for an exam, not let anybody know, that will result in a 0. If it is a personal reason, you can have a late penalty with notification. If it is an emergency, we do require we will require documentation, and that's submitted to the National Dean of Online Nursing Education, and notification must occur within 24 hours of the exam, and the documentation must be presented prior to the exam being rescheduled. And then any exam not rescheduled within 7 days of the class time will result in a 0. Okay, so just keep in touch. If you are having technical issues during an exam, do not continue or try to continue if you are having technical issues. You need to let me know immediately. So I can look through the log. I can, these are more for like your quizzes, but I can see how many questions were seen. I can potentially give a code to restart the exam, but I can't allow retakes of the exam because of technical problems. Okay, so if you are having any issues, you need to let me know immediately. Your specialty exam is going to you'll take that on campus with a campus proctor. You only have one attempt at the leadership HESI. And of course, your HESI can occur anytime in your HESI week. They're scheduled again by the campus according to campus availability. And that is 20% of your testing grade. We know that the benchmark for HESI is 900. And then if your remediation is mandatory. So you take your HESI, you must complete remediation. according to what your score was, is going to determine how many hours of remediation that you need to do. Remember, even if you get a 900, you still have a minimum, or 900 or better, you still have a minimum of 1 hour to complete. So please remember that. Um, the remediation packets are submitted by 11:59 Monday of week 12. All right. So instead of Sunday night due, you have until Monday night at midnight. Again, I will not post those, will not turn the homework grades back on, or post those final grades until everybody has completed their remediation or after 11:59 on Monday. If you don't do your remediation, you will get a 0 on your HESI. Your homework, submit your homework on time. Late work is only accepted with prior approval from the instructor. So if there's something that is going to prevent you from getting your homework turned in on time, you need to let me know prior to when it is due, not after. If it is late, 1 to 7 days, that will result in a 10% reduction, and then 8 or more days late, that will result in a 0 for the assignment. So again, you cannot submit anything late without prior approval from your instructor. Okay, so it's still going to be a late deduction, but you still have to get approval to turn it in late. The adaptive quizzes in SurePath, those are covering concepts from your reading assignments. Each quiz has 50 questions. They are personalized to you. It helps you to increase your knowledge or mastery of the content. The quizzes are taken at home. They're not proctored, but they must be taken in one session, and you only have one attempt at each quiz. And remember, those are going to be 5% of your grade. Your professionalism grade. So professionalism is a key component of your success in the academic environment as well as your career. So I will be completing a weekly assessment of your professionalism in Canvas based on attendance and punctuality. So attends all classes on time. Communication engages in respectful and constructive interactions with both peers and instructors. Respect for diverse populations, value and consider the viewpoints and ideas of others. Adherence to guidelines, follow the dress code and academic integrity rules as detailed in the student handbook. And then engagement and responsibility. Complete all assignments, promptly, actively participate in class activities and discussions, reach out to faculty when with any concerns or issues in a timely manner. This feedback is intended to help you measure your progress and identify areas for improvement. Our goal is to support you in developing professional skills that are necessary for your future success. And your professionalism evaluations represent 5% of your grade. Okay, it is homework grade, so it does count as a grade. Group project will guide the development of your professional goals as well related to the profession. Um, and so I'm going to, I'm going to skip this part because we're going to go through the modules. But tips for papers and projects, use the current edition of your APA manual. So you can go to your Learn resources for Purdue OWL. Use only nursing journals or textbooks. Make sure you have sufficient resources for review and make sure they are no more than 5 years old. So when we talk about evidence-based practice, generally speaking, we don't want to go back any more than 5 years. That'll give you the most current information. Make sure your research relates to your topics, such as nursing leadership. Summarize your key points in your own words, and then, of course, give credit to where you got your information. So cite your sources, whether it's in-text citations, and then, of course, you will have a reference page. And we know, I don't know, you start doing research you start with your initial topic, and then the next thing you know, you're down a rabbit hole and you're looking at all sorts of other stuff. So I know it can be a little bit interesting that way. Um, and biggest things, communicate. Um, Please, like I said, if there's any issues, any concerns, please let me know ahead of time, so we can try to navigate those issues without having any detriment to your progress and course. Make sure that you are, attending your lectures, coming to the exam reviews, asking for tutoring if you need tutoring, read the book, use your course resources, prioritize all that wonderful stuff. And you guys are at the end of your program, so I know that you know a lot of that information. So, um, and I'm sure everybody's already in ExamSoft. There hasn't been any issues with ExamSoft and all of that stuff. Um, So just kind of want to touch base. Anybody have any questions so far? Everybody can get into SurePath and see all, and get their textbooks and all that wonderful stuff. Yeah,
So,
okay.
Professor Martinez, does
Yes.
SurePath coincide with what our modules? Because in the past, SurePath didn't correspond with what our modules say.
So when I set everything up, as far as I know, it should. So what I can do, um, let's see. So for week one, you just have your adaptive quiz practice.
Like sometimes we'll do the work and it'll say that our assignment is late.
So all your grades or all your grades, my apologies. All of the due dates are in SurePath. Okay. So, and then in, maybe I'm just going to share and I'll show you. So here is your course shell. All right. So here's your course shell, right? You have your welcome, your announcements page. So again, please look at your announcements. And so we have our modules. Um, I'm gonna go like right here. So week one, you have your practice. So you should be able to just click on that and go in and to do the practice. We will also look at identifying your group project, which is due in not till I forget which week. Um, it is not due until
There's March the 9th.
March 9th. Yep, and I just can't remember. It is in week 10. And I will split you guys up in groups for that as well. But you should be able to just click on your adaptive quiz and complete it. But what I was gonna say is your to do if you go, and of course now I can't find one. I'm gonna do this in student view. And it might not let you now just because it's not open, but it's not going to let me. Oh, it will. Nope, it won't. Let's all your due dates are in is what I'm trying to tell you, Tasha. But yes, all the due dates are in for some reason. My internet's like really slow this morning. I don't know what's going on. But all your due dates are in, and so it'll tell you like your due dates for your adaptive quizzes are in. And then it'll in Canvas, it'll give you the what is it, like your late day up to your 7 days. So if it's due on, let's just say, so if it's due February 9th in Canvas, it will tell, give you that extra 7 days. You still have to do it, and then I'll have to go pull it out of SurePath to put your grade in. So yeah, all the dates are in there. Um, so you shouldn't have any issues. If you do have any issues, let me know as soon as possible. This way I can make sure that I get that fixed so we don't continue to have issues. I like everything to be nice and smooth for you guys to try to make it as, as as seamless as possible. I'm going to pull up your syllabus. Again, I don't know. My internet is like super slow this morning. I'm just glad Zoom's working good. All right, so here is your syllabus. So our total contact hours are 30, about 60 hours for out of class work. All right, so again, 30 hours of lecture. Um, and your course description, your student learning outcomes, your course learning outcomes, all of that stuff are listed for you. These are your required resources. So you should have access to your success in practical vocational nursing book, your concepts book, your nursing delegation and management of patient care. And then, of course, your adaptive quizzing, your SurePath learning modules, and then, of course, all your other books that you have gotten throughout your program. Again, you have to have that 78, right, in order to meet KGA, in order to pass the course. And so there's 3 unit exams, which are 60% of your grade. Then your HESI leadership is 20% of your grade. Your adaptive quizzes are 5%. Your lesson activities are 5%. Your leadership group project is 5%. And your professionalism grades are 5% as well. All right. And so they broke this out of class time down for you. So readings, 25 hours, adaptive quizzes, 5, lesson activities, 5, your group project, 15, and exam prep, 10. So over the 12 weeks, you should have 60 hours outside of the class time in order to complete everything that is required. So week 1, we're going to do chapters 4, 5, and 12. You will have your adaptive quiz practice. We'll also identify the topic for your leadership group project. Week 2, you'll have lesson activity 1 and adaptive quiz number 1. So lesson activities on chapter 6, your adaptive quiz is on chapter 6 and 7. And we will go over chapter 6 and 7 in class. Week 3, you will have unit exam 1, and then of course we will have some lecture after exam 1. Week 4, lesson activity 2 and adaptive quiz 2 are due. In week 5, you have lesson activity 3 and adaptive quiz 3. And then week 6 is going to be your unit exam 2. Week 7 is lesson activity 4 and adaptive quiz 4. And then week 8 is adaptive quiz 5 and lesson activity 5. Week 9 is your third exam. And then week 10 is when your leadership group project is due. There's also your HESI practice adaptive quiz. And then week 11 is HESI week. And then week 12 is your the check-in. So one thing that I do want to say about your leadership project, it is a group presentation. So you guys will complete your presentation and you will present that during class. So everybody has a part to play in that. And I'm going to pull up that project. And so again, share my screen. All right, so you will be assigned to a group. Oops. And then each group will select a topic from the list below. And then as a team, you'll research the topic, connect it to PN practice, and create a visually engaging poster to be presented in week 10. And so the topics, we have the PN and the nursing process, navigating ethics and boundaries, leadership and delegation, PNs and shared governance, and then evidence-based practice and quality improvement. All right. So again, it is open for you, so you can kind of look through the topics. Each group will have a different topic. So there's not going to be, four different presentations on PN and the nursing process. Each group will have a different topic. It'll be first come, first serve. And you can do, we can do a poster. And I know it says how you can do a poster online. But there are ways that you can use templates and things like that, that we can discuss that moving forward as well. How we'll go ahead and present that. But with that project, everybody needs to present. So we do have a couple people that are still missing, I think, from class. But we will split everybody up equally, and try to make sure that everybody needs to participate, like I said. So when during the presentation, everybody needs to present at least part of that.
I have a question.
Yes.
You sent something out this morning when you were going over the syllabus. So it says exam 1 is in week 4 because of a holiday. And then you moved exam 2 to week 6. Is that
Mhm.
correct? So the
Mhm.
syllabus isn't correct?
Correct. And just because of a holiday. I think, what holiday is it? Is it Martin Luther King Day? Is that,
MLK Day.
So we're really going to have one class before the next exam in between 4 and 6.
yeah, I know. Um,
Whatever.
there are going to be multiple test review options as well. So there are going to be exam review options. Trying to think, there's 4 instructors. I think it's 4. And so there will be opportunity for at least 4 review sessions for you to attend. And then the last thing that I want to show you, this is the syllabus cover sheet for the course. Okay. So my office hours, I'm going to have to change. I'm supposed to be Tuesday and Wednesday. I will adjust that and resubmit that. But my office hours are going to be Tuesdays and Wednesdays from 9 a.m. to 10 p.m. using the same Zoom link that we do for class. Again, 9 to 11:57 a.m. is our class time on Monday mornings. If you look here as well, you have access, there's my cell phone number. So if you want to put my cell phone number in your phone, or have it handy in case there is any issues, but please reach out. The other thing that I want to say, so again, I will fix, I don't know how I put money in Tuesdays, knowing I'm in class. So my office hours will be Tuesdays and Wednesdays. Now, for tutoring options, if Tuesday and Wednesday mornings do not work, and that's absolutely understandable, please reach out. Let me know what days and times that you are available, and we will work out a tutoring schedule that meets your needs. The only time that I am not available is if I'm in class. So again, if those office hours do not work for you, go ahead and just send me an email, send me a text, call me, whatever, and let me know some days and times that do work for you. And this way I can make sure that I am available to you. So our goal is to have a successful term, right? We want everybody to be as stressless as possible, to make sure that you are successful in this class. And I am here to help you. So I know a couple of you I already know. Um, so, um, just from being on campus, but if there is anything else that I can do to help you become successful, please let me know because that's my job. I'm here to help you be successful. So, all right. Any other questions about the course, about the syllabus, about the orientation, anything like that?
I do have a question.
Yes.
So for next week, we have to attend a in-person class that conflicts with this class. When would we be making up your class?
What do you have next week?
It's a I don't know, they want us to come in class from 9 to 4
It's
on
a
campus.
campus HESI review thing that is mandatory. It's 2 days in a row.
Oh, is that like your live review, your NCLEX live review?
No, it's not a live review. It's some I don't know. It's new to us. So, but it's 2 whole days in a row and it's the whole day, both
It is
days.
a live review.
Oh, is it?
It's a
I don't
live
know.
review required on campus by the dean.
Which campus is that again?
Westerville.
Columbus.
Westerville? Okay. All right, so I will find out for you, Sarah, okay? Yep, I will get that information for you. Anybody else? Does anybody else have their live review scheduled yet?
That's for Martha, me, Sharada, and Destiny.
Okay. So you said Martha,
Sharada, Destiny, and me.
And Alima too.
Sorry, Allie.
Okay, I will find out. I'll send an email right after class and get that information for you. Okay? All right. All right, so before we get started with our lecture for today, so we have 3 chapters to do today. So it's chapters 4, chapter 5, and chapter 12. We'll go ahead and take a break. So be back at 10:05. Mhm. All right. Destiny. Where's Destiny? Destiny, what campus are you from?
Westerville.
Westerville. And London, what campus are you from? You're on mute, hon.
Westerville.
Westerville. All right. I
Can you hear
got
me?
everybody. All right. So we are going to start with chapter 4. Get the right PowerPoint, we'll be good to go. So chapter 4 is the evolution of practical nursing. So how did we get to where we are in with practical nursing? And so has anybody looked at any of the chapters for this week? Yes, awesome. I saw some yeses, so
Yes.
I'm gonna just take that. All right. I will share my screen in just a second. All right. So now you guys have access to the PowerPoints. Um, However, we'll go ahead and just share the PowerPoints. So modern practical nurses. So how are we trained today? So obviously, since you're sitting in class, right? We have educational programs for our practical nurses, which combination of theory, which is your lecture, your clinical simulation, right? So your sim, when you go into the sim lab and work with the mannequins, and then of course your clinical your clinical hours. And then after licensings, you are permitted to perform the job role of the LPN as aligned with the respective state requirements. So finish your program, right? You still have to take your NCLEX, which is, your national exam. And that just shows that you meet the minimum standards to practice safely as a graduate practical or vocational nurse. Um, and then most state regulations stipulate that LPNs work under the supervision of the RN or a healthcare provider. And that's going to depend on where you're working. And so if you're working in, on a unit, then you obviously will, most cases you'll be working under an RN. But if you're working in a clinic, right, then you might be working under a nurse practitioner or an MD, depending on what you want to do, or where you're working. So we'll go all the way back to the first school of nursing. In 1836, the first real school of nursing was opened in Kaiserwerth, Germany. Um, and that is where Florence Nightingale started her education. She was one of the first students there. Um, And she, if you don't know who Florence is or was the founder of modern nursing. So during the Crimean War, she helped doctors with her untrained nurses, and then she established a school of nursing in England um, in 1860. And during that time, she wrote a bunch of books, and one of the most famous books that she wrote was her Notes on Nursing, which is actually a very interesting read. So, Nightingale's core beliefs, and I'm hoping everybody has heard of Florence Nightingale prior to now. But she believed that she believed in perfection of mankind. And she also believed that nursing was a sacred calling, a commitment to work for mankind, not a business. And so everybody here in this class, right, has a reason why they are becoming a nurse, right? Um, and when you look at something, whether it's, you know, even just because you want stability for yourself or your families, but a lot of us can look back at some point in our lives and kind of identify the reason that we want to be a nurse, right? There's some sort of I don't want, there's a calling. Um, you have to want to be a nurse. You have to want to do this because it is a lot of hard work. It's a lot of stress. It's a commitment to other people, right? We're taking care of people on some of their best days as well as some of the worst days of their lives, right? So we have to want to do this. Um, she was against licensure like into a union. She also pushed for nursing to be a respectable vocation, right? So she started all the way back in the 1800s pushing for nurses to be respected, to be professional. And she did a lot of work during her time in helping to improve healthcare, even identifying ways that, you know, um, illness is, uh, or what's the word I'm looking for? Illness is passed from one person to another. A lot of the things that we do today are based off of Florence Nightingale. When we look at the early training here in the United States, the first nursing school in the US or in America was started by Plaster Fleidner of Germany. The hospital that is known as Pittsburgh Infirmary still exists in Pennsylvania. It's Passavant Hospital. Um, and as the nursing shortage, even back then, we had a nursing shortage. Um, and as that continued, hospital-based schools of nursing emerged as cost-effective labor force for the hospitals. So when we look at traditionally and some of the hospital-based programs, they spend a lot more time in the hospitals on the units. And so when we look at that, with the nursing shortage, we had nursing students that were learning a lot of, on the job training, so to speak. Um, there was a lot longer hours. I know a lot of you do 12-hour clinicals, and they did a lot more as basically just free labor for those hospitals that were experiencing nursing shortages. So formal training, in 1893, the Ballard School opened in Brooklyn, New York. That's where I born and raised in Brooklyn. It opened in 1893. The courses were 3 months. They focused primarily on home health care for chronically ill, elderly, and children. So the first LPNs they did more community-based nursing, more home health nursing when they were first introduced. And then, like I said, before World War One, most nursing care was done in the patient's home. And so they would do things like cupping, they would do midwife roles, they would do leeching, administering enemas. Anybody heard of leeching before? They're actually brought that back. So leeches, they suck blood, right? And so they would apply leeches to help increase blood flow to areas, especially in wounds, because they helped bring blood in. Now, don't know how they did it back then. I do know now they actually have like sterile leech farm. I don't know if they're sterile, but leech farms where they actually get leeches to perform some of these to when they do leaching. It is a practice that's still used. It's not as common anymore, but it does help to, like I said, increase blood flow to the area. I don't know if I could do that part of it. I would have to be like, I don't know if I can do that. We might need to get somebody else to help me with that. Um, but they also did some other stuff to kind of help. They also like I said, they did midwife roles too, and would even teach like new moms how the basic um of how to take care of those newborns. And then by 1903, states began to take steps that led to monitored practical nursing. So organizations were developed like the National League of Nursing, and the National League of Nursing developed a nationwide system of standardization of nursing requirements for practical nursing. So there was no standard. So you went to school in one area, you might learn one set of things, and you go to school in another area, you're gonna might learn something completely different. So there wasn't a standardization. And so that is one of the things that the National League of Nursing did bring to us and kind of set that. All right, so here's a practical nursing program, and these are the things that we need to teach those students across the board. Mississippi was the first state to pass a law licensing practical nurses. And so and this was really important, right? Because nobody really knew who was providing nursing care. And so we kind of went to this, they were the first state that passed a law licensing practical nursing. Um, Licensing wasn't mandatory. And then 1938, New York was the only state to have mandatory licensure. And so now we know that all states require mandatory licensure for nurses, including practical nurses, your registered nurses, your nurse practitioners, all of those wonderful things, right? So you can get through your nursing program, right? But in order to actually practice as a nurse, you have to pass your NCLEX and become licensed, apply through the Board of Nursing. And then in 1944, the U.S. Department of Vocational Education conducted a comprehensive study of practical nursing. And so they looked across the board and they're like, okay, what do we need to do? What can these nurses do? What can't they do? Um, so the Department of Vocational Education, they broke it down and they said these are the tests that practical nurses can do. And gave a they used phrases that describe the LPN scope of practice. And so these, in a sense, should sound familiar to you a little bit. But it's judge, appraise, recognize, and determine. So that initial nursing process that we know today is add PI, assessment, diagnose, plan, intervene, and evaluate. The initial was judge, appraise, recognize, and determine. The Joint Committee on Practical Nurses and Auxiliary Workers in Nursing Services recommended the use of the title LPN, so Licensed Practical Nurse. And we know, I know Texas is one that uses licensed vocational nurses. And I think there's a couple other states that use LVN instead of LPN. So it's depending on what state that you are in is going to determine what your title is. It also differentiated the tasks of the RN and the LPN, including the LPN being under the supervision of the RN. All right, so those were all set. And so again, this is where, we say these are the things that the LPN can do, these are the things that the RN can do, and so on and so forth, right? Your nurse practitioners, your advanced practice nurses, those kinds of things. And then we have the American Nurses Association. So the ANA moved to two levels of nursing. They recommended that RNs graduate from a four-year college program. So, most of your university settings, right? They wanted these nurses to go through a four-year college program in order to become registered nurses. They recommended that LPNs graduate from a two-year technical program. Um, and so, that four-year program, you're going to get a bachelor's degree, most likely. LPNs generally don't get a degree. It's usually just a diploma program. But then, of course, that wonderful nursing shortage that we have all heard about, and the two-year associate program survived. So there are traditional two-year nursing programs that many, schools still offer. Um, like, some of your community colleges will offer a two-year program to get your associate's degree. We know schools like Fortis and other schools as well offer that shortened program in order to get your associate degree. And then, of course, you can move forward with your education as you move on. In the 1990s, the UAP were hired to give patient care, so your unlicensed assisted personnel. The major concern was the legal responsibility for the RN or LPN of the care they gave. So when we look at delegation and we look at supervision, right, we know that the UAPs fall under the licensed nurse. And so as we delegate to those UAPs, we know that we are still responsible for the care that they are providing. But they are an excellent source of assistance for us. And then LPN improvement moved from hospitals to community. So we started off in the community, right, as home health nurses and moved into the hospitals. And then LPNs moved out of the hospitals back into the community setting. And so with that being said, now, right, we're going back into the hospitals, right? So just as in context, I've been a nurse for will be 26 years this year. And I actually started off as a home health aide, and then I was a CNA, then I was an LPN, and then I became an RN. But when I first became an LPN, that is when they were transitioning LPNs out of the hospital. So we did a lot of our clinicals in a hospital. Um, and there were still a few LPNs that had been grandfathered into the hospital setting. But for the most part, LPNs were phased out of the hospital. So we were in clinics and long-term care, and the community. Um, and now you see with the nursing shortage, LPNs, they realize the value of LPNs, and they are pulling them back into the hospital. And that we have realized that the role of the LPN is important when we're providing care, and they bring a lot of help and a lot of knowledge to the nursing workforce. The first computerized testing for NCLEX was in 1994. So I don't know if anybody knows. So like I said, I was born and raised in Brooklyn, New York. I went to high school in New Jersey. And my mom went to nursing school in New Jersey. And when she took her NCLEX in the 80s, It was 2 8-hour days of testing. So they had to drive. So they only offered the NCLEX once a year. And so she had to go to Atlantic City, in one of the hotels, like, in the big, like, ballrooms or whatever, they had it set up, to test. It was pen and paper. It was short answer. It was care plans. It was, I don't even know what else. I wish if she was still around, I would love to ask her again because I don't remember. I just remember it was 2 days of testing, and it took up to 6 months for them to get their test results. And they actually got a grade. Like, you take a test, you get a grade. They actually got a grade on their NCLEX. It wasn't just like, here, you passed or you failed. But yeah, they had to wait 6 months because it was handwritten, so it had to be hand graded. Um, and I don't know what the scoring system was. I just remember it took a long time. But imagine it was only offered one time a year. So if you didn't pass it that first time, you had to wait a whole another year in order to take it again. Hmm. And I actually, when I was like right out of high school, I was waitressing, and one of the waitresses that I worked with, she had failed it. She had already failed it like 6 times. So yeah, 6 times. And so this was still on paper. So she was still waiting kept going back to take it. I don't know what the cost was back then. But that's a lot. That's a long time to wait to have to take your NCLEX. The traditional nursing programs back in the day, they graduated in April, and the NCLEX was usually in like May or June. So it's a little bit, obviously, a lot different than it is today. Um, in 1996, long-term care certification became available to LPNs. So you can, get a long-term care certified. Um, with the goals of the associate degree programs were to move nursing education out of the hospital-based programs, and help ease the shortage by shortening the amount of time required to become an RN, right? So we know, like, there's programs like Fortis and other programs that have shorter, programs, so you don't have to do the whole 4-year program, right? You can do some of the shorter programs. Um, the NLN vision statement recognizing the role of the licensed practical nurse in advancing the nation's health, of course, supports the role of the LPN. And we know COVID, and everybody knows COVID, puts a huge strain on the healthcare workforce, leading to a greater nursing shortage. And that was another reason why they're starting to bring LPNs back into the hospital setting. And so some of the hospitals are doing what we call team nursing, which is, you have an RN, you have an LPN, and then you have a CNA. And each one has their specific, task to perform, and get it done. And so it helps to, break up, the workload for, each one of them. So it really just depends on where you're working. Um, so I'm going to pose a question here. So tell me, who has already thought about where they want to work when they graduate? Where are some places that you want to go and work
Men-
at?
mental health,
Mental health. Oh, wow. Okay. Who else?
Case management or insurance.
Oh, okay. Case management. Okay. Anybody else? Nobody's really thought about it. What are some of your, let's see this way. What are some of your favorite clinical experiences so far?
mental health.
Mental health. Josh is like, I just like the mental health.
I like the ER.
Oh, the ER. Okay. Awesome. Awesome. London, what about you?
I think I want to go into not so much as like a school type of nurse
Oh,
for
like
the
a school.
kids.
Okay.
Yeah,
Okay. Do you like kids?
not really, but
Oh.
they pay well, so I could like them.
Okay. So school nursing is interesting. I love so my practice, and I know this is I'm both ends of the spectrum. So I've done peds and I've done geriatrics. Those are my two loves. I also did an insurance company for a little while. That was an interesting experience. Um, I didn't do case management. I did what we call utilization management. So I was a lead. And so we were the one I worked in a government contract. So your military people that have TRICARE insurance, that's who I worked for. Um, and that was interesting, but we did mostly referrals and authorizations. So I was the one like, if they got a referral, this was back in the day, got a referral for, dermatology. I was the one calling the dermatology clinics to see if they could get the patient in because we had a 30-day rule. If the provider couldn't see our clients within 30 days, we had to find another provider. So it's a little bit different there. I handled mostly escalations, a lot of authorizations, for, different things, medical equipment, formulas, that kind of thing. Um, but it's interesting. Um, Tasha, I love your passion about mental health. Um, my mom was actually a psych nurse, and I tried to steer clear as possible from psych nursing. I do, however, love my dementia Alzheimer's patients. Those are my absolute favorite. I love dementia. I love my Alzheimer patients, and it kind of goes with the territory working in, long-term care. Um, but yeah, the other kind of psych. Oh, I don't know, but God bless the ones that want to work psych. Does anybody else? So possibly peds. We got a mental health. We like ER. We like case management. Um, anybody like, trying to think. Nobody likes long-term care.
I liked OB too.
OB,
I like long-term care.
do you?
Mhm.
Long-term care, and just like every other aspect of nursing, it can be very stressful, very, overwhelming at times. There's going much like mental health. Um, we have a tremendous need for mental health providers, both nurses as well as, clinicians like your nurse practitioners and doctors. There's going to be a huge need for more long-term care nurses. Think of the baby boomer population as they begin to um, get older. The need for their care. There's going to be a huge need for geriatric nurses as well as geriatricians. Um, and not just in long-term care setting, like in a nursing home. It's also going to be in home health too. So that baby boomer generation, actually, I think it got beat out by this last generation. It's actually bigger now, but they were the largest generation. They had the least amount of kids. And so they, some have, of course, their children and grandchildren that can help take care of them. Others did not. And so there's going to be the need to provide care for them as they age. So and we already know that there's a huge mental health crisis here in the United States. And so taking that into consideration too, psych nursing is, very um, it's a good practice. I mean, my mom loved it. My mom worked for a state psychiatric facility in New Jersey. So it really just kind of depends on, what you want to do a lot of times people, they come in, to nursing schools, they already have an idea of what they want to do. Sometimes that changes, sometimes it doesn't. It really depends. If you had asked me when I was in LPN school, I would have told you there was no way I was ever going to work in a nursing home. There is no way I am never going to work in a nursing home. And I got into a nursing home and I loved it. That is something that, even with opportunities to go to other places, I stayed in long-term care. Um, and then even now I still work in long-term care. I work overnights. So it's just something that, you develop a passion for something. But another really great thing about nursing is you start in one area, you can go to another area, right? You start in one area, you're saying, oh, I don't like this. Maybe I'll go try something else. And that's the wonderful thing about nursing is there's so many different opportunities out there. So, all right. So we're going to go to chapter 5. Chapter 5 is critical thinking, okay? Which is something that I know that you've heard over your, time in nursing school. Um, and so when we look at it, um, there are, what's the word I want to look at? There's the top 10 reasons to improve thinking. And I will share my screen. Oops. All right, share. All right, so the top 10 reasons to improve thinking. And these were adapted for the practical nurse. So, number 10, things are not what they used to be or what they will be, right? In the changing healthcare system, right? So, even down to some of the things that I learned as an LPN or even as a CNA, um, we don't do things that way anymore, or there are certain things that we don't do anymore that we were taught and used to do. Number 9, LPNs frequently care for clients as members of the healthcare team who are not yet stabilized and have multiple problems, right? And so when we look at delegation, all right, so, delegation, we usually have to delegate a stable patient, right? But think of your long-term care experience, or even if you want to go work in the emergency room, right? You're going to take care of patients that may not be stable, right? That are going to have multiple problems, and you're going to have to prioritize those problems in order to care for your clients. Number 8, more clients and their families are involved in healthcare decisions. So we can chalk this up to the internet for a lot of it. Um, they a lot having access to the internet and doing research, right, helps us to learn about disease processes and treatment availabilities, right? So we have, much more informed clients. They want to be more involved in their care. Um, Number 7, LPNs must be able to move from one healthcare settings to another. And that's kind of what I was just saying, right?
Things to counteract the metals that we have in our bodies that wear us out, removes the parasites from your system. What do you feel? Well, I used to have really
okay. London,
dark
you.
circles in my eyes. It's gone away in the last 6 months. I've been using that. My skin, I'm 55 years old. Do I look?
Okay. Sorry, I thought she was talking. But just like I was saying, right, you can start off in one area of nursing. Don't like it, you want something different, right? You can go into another aspect of nursing. 6, rapid change in information explosion requires LPNs to develop new learning and workplace skills. So how do you plan on staying on top of, the changes that are occurring in healthcare, right? We have to, be, what is it? Lifelong learners, right? Just because you're done with school doesn't mean you're done learning. How many of you want to go back and get your RN when you're done? Yep. So, getting, and it's even if you decide that you don't want to go back to school, you're still going to learn. You're going to learn new things every day. Um, Five, clients, families, and insurance companies demand to see evidence of benefits, efficiency, and results of care given. So this is a big thing. There's been a huge push from the quantity of care that we're providing to the quality of care that we're providing, right? So they want to see, right, what's the benefit of what we are doing. It's one thing you can be in and out of a patient's room 100 times a day, right? Providing care 100 times a day. But if the quality of the care that you're providing isn't there, right, then what's the benefit to that? Um, we also when we look at quality of care too, it's preventing those secondary infections, right? Like your catheter associated UTIs, your pressure areas, right? Preventing falls. And number four, today's progress often creates new problems that cannot be solved by old way of thinkings, right? So things like your ethical and legal issues and your end of life decisions, stem cell research, right? Determining who is entitled to receive expensive medical care. And so, these are all things that we're going to face as future nurses. Um, you know, there's lots of ethical issues in end of life decisions. Stem cell research will always be a potential for controversy as well. And determining who is entitled to receive expensive medical care. Is it because they have really good insurance? Do they have a lot of money? How do we determine, who gets care and who doesn't get care? Three, redesigning care delivery and education programs is useless if students and nurses do not have the thinking skills required to deal with today's world. That's a big thing. Critical thinking is absolutely necessary as you're in your role as a nurse. You need to be able to recognize subtle changes, right? React on your feet, do the right thing. Two, learning how to improve your thinking skills does not have to be difficult. And then one, your ability to focus your thinking on how to get the result you need can make the difference between whether you succeed or fail in a fast-paced healthcare system, right? So all of the information that you've obtained throughout your nursing program, right? It's like pieces to a puzzle, right? Each class, each topic is a piece to a puzzle. Okay. And now here at the end of your program, right, we have all those pieces to the puzzle that we have to put in that puzzle and make it make sense. And so, how, all the way back to anatomy and physiology and understanding how the body systems work together, right? So you have to be able to look at a patient, do your, data collection, right? And try to see what's going on with that individual client and what can you do to help that client get better. So when we look at critical thinking is related to the nursing process. And we know that the 5 parts of the nursing process: assessment, diagnose, plan, intervene, and evaluate. So critical thinking is absolutely related to the nursing process. It's also used in clinical judgment. So what's clinical judgment? What's clinical judgment?
Evidence-based, right?
Okay, clinical judgment is evidence-based, absolutely.
But don't you have to use like the nursing process to go on the scientific methods. That's when you do the API, you wanna assess your patient. Nurses are not able to diagnose, but you're like giving the doctor like suggestions maybe. Like you think
Okay.
the patient, now you got a just say you have a patient who has like acute um delirium. They yesterday they were better, but today they're like confused. So you're able to say, hey, let's run a UA on them. So that's where you're going to be diagnosed, and then you like planning, doing your interventions. Is that what you're saying?
Yeah, no,
Like,
absolutely. That's awesome. No, that was great. Yep. It's our decision making process, right? That's what we use to interpret data. So like I said, just like you said, you're going to get all of your data. You're going to get your subjective data, your objective data, right? We're going to get all of that together. And, in conjunction with that RN, we set up our nursing diagnoses, right? And then we establish those short-term and long-term goals, and then we get our interventions. How are we going to help our client meet those short-term and long-term goals that we have all set? And we go back in and evaluate. So absolutely correct, right? And so in order for clinical judgment, right, we have that basic knowledge that we have learned throughout our time here in nursing school, right? And so you get all that nursing knowledge, right? And then some of it's going to be based on experience, right? Some of you may have experience as a CNA or a care technician or a medical assistant, a pharmacy tech, whatever. Um, and so you're going to take all of that knowledge that you have. And, it's a process of, you know, constantly assessing, analyzing, interpreting, all of that information that we are getting from our clients, right? And then all that information, we have to process it, right? And so it's that data interpretation, right? So we have to learn to recognize patterns, trend data. We have to be able to understand what happens when things change, right? Patient was completely stable, and all of a sudden now my blood pressure is dropping, my pulse rate is going up, I'm short of breath. Like what, we're kind of have to look at all of that information. And then what are we going to do? So absolutely, that was a really good explanation of it. And then the LPN is expected to be an active learner and a critical thinker. All right. So critical thinking, it's just an advanced way of thinking. It's a problem solving method. And so we can use it to um, resolve problems, even find ways to improve situations that, potentially, even if there's not a problem, right? So let's think about that elderly person in a long-term care setting. And everybody here, I'm sure, has been into a long-term care facility, whether it was for work or for a clinical experience, right? And so what are some of the challenges that we have in long-term care? Falls is one of the biggest ones that we have, right? So what do we have that's different? So we don't have side rails, right? Um, and so that's one of the big deterrents, right? If you're in a hospital bed, you got side rails on, and the chances of you rolling out of bed or falling out of bed are a little bit less than in a long-term care setting. So fall is one of the big challenges that we have. And so even if the client comes in and has never had a fall before, that's still a potential problem, right? Because, just like you were talking about with delirium, delirium can occur in any change of setting, especially in an elderly person, right? And so what does that do? That increases their risk for falls, right? So we sometimes have to think out of the box. What can we do? We know the basics, the call bells in reach. They have their water, their side table, their bedside table. They have their TV remote, right? The bed's in the lowest position. But those are not really fall deterrents, right? Those are just accessibility to kind of help to try to prevent that from happening, right? So that is, that's all critical thinking. What are some of those out of the box methods that we can try to use, right, to help prevent our patients from falling? Um, applied critical thinking is purposeful, it's informed, it is driven by the client and family needs. Because we know that the client or the patient, right, they are the center of our plan of care. They are the center of our nursing process. Um, so again, it's based on the principles of the nursing process, your knowledge, your skills, your experience. Of course, your nursing code of ethics is going to be part of that as well. It is logical, it is guided by professional standards. And again, it's constantly reevaluating and striving to improve, right? So, how can we help our client achieve the highest quality outcome, right? What resources are essential? What can we do, right, to provide that high quality care to keep our clients safe? So, thinking. So, who would have thought that there are so many different types of thinking that are out there? So non-focused thinking. And so non-focused thinking is you engaged your brain out of habit without much conscious thoughts, right? So getting up and getting dressed or getting up and getting in the shower, right? That's non-focused, right? It's something that we do every morning, don't really have to think about it. We just kind of get up and do it, right? Your habitual thinking, well, I guess I would be, sorry, I skipped ahead, right? So that's your habitual thinking is getting to the bathroom, shower, dressing, and so on. Um, Random thoughts. Who's got random thoughts? Multiple short scenes and thoughts come and go through the mind and have no particular purpose or goal. Um, So, how many of you, and that's okay, you can be honest, you're listening to me talk or interacting with me. How many of you are thinking about, oh, let's see, I have laundry to do, I have house cleaning to do, I need to go to the grocery store. Oh, I know, trust me. I totally understand it. Right? Random thoughts. How many of you have worked when you've been at clinical, even talking to some of your clients or the patients that you worked with, and they're telling you a story, and you're like, oh, but I got to go fill out this paperwork. I'm really hungry. I wonder what's for lunch, right? We all do it. We all do it. Um, those wonderful random thoughts that kind of pop into your mind. Ruminative thinking, this is the same situation or scene is replayed in the mind over and over without reaching an outcome. This is your instant replay. I think of this as you ever have a situation where, so I don't know, something happens and then, maybe it was let's just use a frustrating situation because sometimes those stay in your head a little bit longer. You have a frustrating situation and then you go home and you start thinking about it and you're like, oh, I should have said this. Why didn't I say that? Why didn't I do this? Why didn't I say that? Right? So you're not really reaching an outcome. You're just thinking about it. Your all or none thinking, the mind is made up and no additional effects will be considered. So that's your black and white, right? There's no gray area in between. Your negative thinking, the mind is stuck on negative thoughts and blocks worthwhile thinking. This is your emotional sabotage. I'm not good enough. I can't do this. I don't know why I'm here, right? Just get away from those negative thinking. Directed or focused thinking, this is purposeful and outcome oriented. And then your problem oriented thinking is focus on a particular problem to find a solution. All right, so that brings us back to critical thinking. So it's an advanced, again, I already talked about this, but it's an advanced way of thinking, a problem-solving method. It's used to resolve problems, right? Find ways to improve even when no problem exists. We're collecting and analyzing data to make that decision. And it answers questions like, how can we do this better? How can we assist the client in achieving the higher quality outcome? What resources are essential? What can be eliminated to cut costs? All right, so critical thinking in the LPN. So questioning with meaning. What does it mean to question with meaning? Good question, right? What does it mean to question with meaning?
Is that more like a oh my God, I just had a brain fart. Like a open-ended, like you're not telling the patient what to say, but you're letting them express themselves.
Okay. Okay. Yeah, we're asking questions. I mean, that's what questioning is, right? Um, it's more of trying to find, I don't know, um, we want more meaning behind how do I want to say question with meaning? We're looking at, I don't know, the purpose or the truth behind something. It's, more of we're trying to get a deeper understanding of what is going on, right? So rather than just, I don't know, when we look at questions, right, we have those open-ended, we have closed-ended questions, right? It's really asking more of those open-ended questions, right? To really kind of dig deep, to get as much information as we need, right? Without really, um, what's the word I'm looking for? Without becoming, I guess, overbearing or too nosy, right, with our questions, right? So we're trying to really get, as much information as possible. We always make our judgment based off of facts and not assumptions, right? And this is one thing that as nurses, we really have to look at. Um, is making sure that we are making judgments based on the facts, not assuming, right? And this is where like our own biases and our own stereotypes may come into play and try to avoid those. Collaboration is a key to effective thinking, right? And so as part of the healthcare team, you are going to collaborate not only with other nurses, but with therapists and providers, even your UAPs, right? Um, and all kind of, it's like I used falls as an example, right? You can get the team together and be like, okay, we've got the fall mats, we've got the bed in the lowest position. What are some other things that we can do to try to help this person prevent falls, right? Because another thing that we don't have in long-term care that you have in a hospital is bed alarms, right? You can't use bed alarms. We don't have anything like that. So we have to really, work together to try to identify some really good interventions. Always use the nursing process. And decisions are based on the right thing to do rather than emotions. And so that is something to really take into consideration as well, right? What is the right thing to do? And then how do you challenge yourself? Ways to challenge yourself, to think critically. And one thing that I've always say, and I've always told students about the nursing process, if you're not comfortable with the nursing process, okay, you can use the nursing process for anything. You can use it on, I'm going to make a peanut butter and jelly sandwich for lunch today. Okay. And you can break down the parts to that into an ad pie and really learn how to use the nursing process. Um, But when you look at box 5.1, these are ways to challenge yourself to become to critically think. And so, it's just ways to help you, even as far as anticipating your client's needs. Always asking for clarification. If you don't understand something, ask. Don't just assume that you can work your way through it or muddle your way through it. If you don't understand and you need clarification, ask. Um, Ask yourself if there is more that you can do to improve your client's outcomes. What are some things that are potentially beneficial to our clients? So you can go through that box and it'll give you some really good information. Factors that influence critical thinking, your upbringing, and your culture. How does your upbringing and your culture affect your critical thinking?
You basically don't want to be biased against someone's culture. Just because you believe in something doesn't mean that they believe in that. Or you want to respect their boundaries of their religion, their nutrition, how they eat. You just want to be respectful of, you know, different ways. Just don't be biased about it. Just be open minded. I guess that's what I'm trying to say.
Okay, perfect. Upbringing. Everyone's had a good teacher, everyone's had a bad teacher. Everybody has had somebody that has supported them in their lives, and people have had people that do not support them in their lives, right? Um, and that can affect, right, your critical thinking abilities. Motivation. Oh, wow. What is your motivation? If what are your internal motivators, your external motivators? Motivation determines, some of the progress you've made in problem solving and critical thinking too. And so, you know, the more you work your brain, the more motivated you are, the better off you'll be. Attitude. How does your attitude affect critical thinking? That's a big one. How did your attitude affect critical thinking? Who knows a know-it-all?
I was gonna say if you're closed off and not open to other things, then you're not gonna like think of all the options available.
Exactly. Exactly. Right. So being able to recognize that you don't have all the answers, right? That's a big one. If, we've all met the one person who knows it all, right? They're less likely to, take in, other people's opinions or attitudes, or opinions or even facts. And so, you have to be humble, you have to be open in order to think critically. Other things, effective reading, problem solving. Effective reading is, sometimes a hard, um, um, what's a word? A hard task for some. If I hand you your med surge textbook, 2,000 pages of words and pictures, right? And tell you have, 3 days to read that. And I'm going to give you 150 questions on that book, right? Are we able to read effectively? Can we use the nursing process? Maturity, age, past experiences, they all influence our critical thinking as well, right? What are some things that we've done in the past that, have worked in this situation? Communication skills, your problem solving, your self-confidence, right? Being self-confident is extremely important in nursing. And that's different than saying, oh, I know it all, right? Self-confidence is being confident in what you do know as well as what you don't know. Your moral development, your capability, your ability to collaborate, anxiety. Nursing students don't have anxiety, right? You guys are stressless, right? There's no stress in nursing school, right? But anxiety can also affect your ability to think critically. And then your mentors. Who here has a really good mentor? Anybody? Destiny, you have a good mentor? You're on mute.
I do.
Good.
I get along really good with two of our campus professors. So I definitely use them as resources at campus and at home.
Awesome. Awesome. So finding someone, whether it's a clinical instructor, whether it's a didactic instructor, a simulation instructor, a lab, whoever, or even somebody that is currently working in healthcare, someone that you look up to, someone that you respect, and asking them to mentor you, is beneficial. A lot of times when you go out into practice, depending on where you're working, you may be assigned a preceptor or a mentor. And that's something that you may, look forward to as well. But critical thinking in the NCLEX, um, and so the different types of questions on the NCLEX. Knowledge is recall and repeat what you have memorized. Your comprehension is your basic understanding. Your application is what is learned, and your analysis is breaking down complex parts and relating them to the big picture. And so, looking at the categories of your NCLEX, these are some of those cognitive levels that you are going to see. We've pushed away a lot of the knowledge questions with that NCLEX. And so, yes, you still have to have, right, that information, that basic knowledge in order to apply that knowledge into some of the higher level questions. But application and analysis is going to be a lot of where your NCLEX questions are going to be. And so really have to kind of pay attention to those higher level questions. Not that the knowledge and the comprehension isn't important, but the application is where we really need to know. We have to be able to apply what you have learned in nursing school. This is also prioritizing, right? Determining what is more important. And then your analysis is, the organization, the prioritization, right? What's more important. And so, when you look at those types of questions, like what patient will you go see first, is kind of where those analysis questions are. All right. So let's put some critical thinking to use. So Jane Harris is 58. She weighs 92 kilograms. Her height is 162 centimeters. She has a BMI of 35.1. Her chief complaint is I've been feeling very tired, thirsty, and I go to the bathroom a lot. She has a past medical history of hypertension. She has a family history of diabetes. She takes lisinopril 10 milligrams per day, and her vital signs are temperature 98.6, heart rate 88, blood pressure 146 over 90, respirations 18, and SpO2 is 98% on room air. There's her labs. So we have a glucose of 178, a hemoglobin A1C of 8.2, cholesterol of 210, LDL of 130, HDL of 38, triglycerides of 220. Geez, her labs are a mess. Creatinine of 0.9, GFR of 88, and a microalbumin of 40. So, using critical thinking, what's the diagnostic criteria for diabetes mellitus? Anybody remember what the diagnostic criteria for diabetes is?
Isn't her creatinine level? I mean, her glucose. I'm sorry, her fasting glucose.
Right. So high fasting glucose, look at her hemoglobin A1C, right? So hemoglobin A1C, we want it less than 5.7, right? Normal fasting glucose is 70 to 99, right? So being able to look at these lab values, and granted, the normal ranges are here for you, right? But she's a mess all around, right? Her cholesterol is high, her LDLs are high, her HDLs are low. Understanding would be based on her labs and symptoms why Miss Harris is likely diabetic, right? So we're just kind of just showing you how the different types fall into play. Application, what initial management steps would you implement? And then analyzing would identify the possible complications of unmanaged diabetes in Miss Harris, right? And then assess the appropriateness of her current antihypertensive medication, right? So that is how those four processes would work. So, right? So we look at what are the diagnostic criteria. So fasting glucose greater than 126, hemoglobin A1C greater than 6.5, your 2-hour plasma glucose is greater than 200 during an oral glucose tolerance test, your random greater than 200 with symptoms, right? She has the classic symptoms, right? So based on her labs, why is she likely diabetic? Because she has the classic symptoms, polyuria, polydipsia, fatigue, her impaired fasting glucose, her hemoglobin A1C, right? And then three, apply what initial steps would you take, right? Lifestyle changes, diet, exercise, right? Medications, assess the lipids, right? And then blood glucose monitoring. And then what are the potential complications, right? We have those microvascular and your macrovascular complications that are potentially um, lisinopril is appropriate, especially in the diabetic, because it does have some renal protection, right? So those are just basically how you would apply that comprehension application analysis knowledge. Oops. All right, so we have a 54-year-old male client admitted this morning with lower back pain. He has a past medical history of heart failure treated with digoxin, furosemide, and metoprolol. Vital signs are normal, no allergies. He's a full code. He has normal sinus rhythm on his EKG. We drew a CBC and a CMP. The critical lab value was called to the nurse, so he had a potassium of 3.2. All other labs are within normal. Okay. The LPN calls the physician with the critical lab value. What orders would we anticipate receiving? So, what orders would we potentially receive? So, he's on DIG, furosemide, and metoprolol, no allergies. Okay. We have a potassium of 3.2. What's normal potassium levels?
3.5 to 5.
3.5 to 5. So what do we think we might get here? Do we need to bring this potassium up or down?
We need to bring his potassium up.
Okay, we need to bring it up, right?
So the doctor would order potassium and monitor his heart rate.
Okay. Yep, definitely going to need the potassium supplement, right? Because what is he on?
He's on the digoxin from Melderside, Metropol. So will we be holding that medication?
No, he's got heart failure. We got to give him his meds. What is one of the big issues with hypokalemia and digoxin? Does anybody know?
Digoxin toxicity.
Salt goes, water follows.
Heart rate.
Digoxin, not Lasix. Lasix we are heart rate. So one big thing with digoxin and hypokalemia increases the risk for dig toxicity. Okay. So that is another thing that we have a potential concern here for. Okay. We can potentially DC the furosemide, but it really kind of depends, right, on the patient. But we could add potassium sparing diuretic instead. Now, potassium sparing diuretic's not going to pull off as much fluid as the Lasix is, but it will help to spare that potassium. Again, we will potentially do a dig level because there is a connection between toxicity and hypokalemia. All right. Um, and then knowing what your normal dig level is. So will anybody know what normal dig level is? I'm not gonna lie, I'm gonna have to. I think I know what it is, but I don't want to give you the wrong numbers.
I'm not sure, but it's a 0.6 to 1.2.
Good for you. I think that's actually right. 0.5 to 2. That's where I was gonna say, but yeah, absolutely, right? So 2.3 is a high or low then, or normal?
I
It's high, right?
Oh, it's high, yeah.
Yep. So anybody know what some of the signs and symptoms of dig toxicity is?
Nausea, vomiting, and halos around light.
Good job. Absolutely. Good job. All right. What's the antidote for dig? Oh, we got one. It's digoxin immune fab. Doesn't have like a really big fancy name or anything like that. But that was good. All right, Alamana, good job. So yeah, so those are some of the type of questions that that you could potentially see. I do need to give you a break, so my apologies on that. And then we're going to get into the nursing process. So be back at 11:25. All right, and so the last chapter. So the last chapter is chapter 12, all about the nursing process. So we know that the nursing process was established by the American Nurses Association as a five-step process. It's a problem-solving format that we use. And it just provided an organized way to identify and respond to client needs within our scope of practice. And it's also another way, it's a way for us to communicate with other nurses as well as other caregivers. So the nursing process from the LPN scope of practice, so gather data is our assessment, right? Then we have our nursing diagnoses, our planning, our interventions, our implementation, and then we have our evaluation. All right, so some specific things about the nursing process, okay? The RN functions independently in all five steps of the nursing process. So an RN can assess, they use the nursing diagnoses, they can plan, they can implement, and they can evaluate. The LPN is only independent in two parts of the nursing process, and that is your data collection and your implementation. All right. So for your nursing diagnoses, your planning, and your evaluation, the LPN has a dependent role. Okay, so they work in conjunction or in collaboration with the RN in those three aspects of the nursing process, right? So again, RN can function independently in all five parts of the nursing process. The LPN is independent in data collection and implementation, and then dependent for diagnoses, planning, and evaluation. All right. So, what do we do during the assessment phase of the nursing process? What are we doing? What are we doing? I know we're gathering data. What kind of data are we gathering? What is the two types of data that we get?
Objective and subjective.
Objective and subjective data, right? And then we're going to verify that data. We can compare the data with the medical record, um, and then we're looking for anything that potentially doesn't match, making sure that we, what do you call it? Communicate the information to other members of the healthcare team. And then we also want to make sure that we document that appropriately. So what's the difference between subjective and objective data? What's subjective data?
This is what the patient says.
Okay. So subjective data is what the patient tells us, what their caregiver tells us. Um, it's symptoms, right? I have a headache, my stomach hurts, my big toe hurts, um, I'm having chest pain, right? It's symptoms. What is objective data?
What we see
Very
as
good.
the nurse, like their vital signs, just maybe their behaviors.
Very good, right? So objective data is going to be signs, right? So subjective data is symptoms, objective data is signs. It's quantifiable, right? It's something that we use our senses. See, touch, hear, taste, smell. I always throw taste in there. Don't ask me why, but you ever smelt something so bad that you can taste it? That's why I always do that. Um, right? And a lot of times we can quantify it, right? Like our vital signs, our lab tests, our radiological exams. We have, evidence, right? What are some barriers that we would potentially face when collecting data from our clients?
It might be embarrassed to.
Language barriers.
Okay, embarrassed. Somebody else said something else.
Somebody
I
said
said
language
language
barriers.
barriers.
Language. Yep. What did you say, Tasha?
I was just repeating what someone else had
Oh,
said.
okay. So yeah, so they might be embarrassed. There may be some things that they don't want to tell us, right? Or they don't speak our language. That is potentially an issue as well. Um, Cultural differences, right? Personal biases can be a barrier as well. And so these are things that we have to take into consideration when we're working with our clients. So again, okay, the LPN works independently in which two parts of the nursing process?
Data
Data
collection.
collection and implementation.
Very good. Data collection and implementation, and then the RN diagnoses plan and evaluates the plan of care. So tell me about goals. What should our goals look like?
Measurable, and then
Very
like a
good.
short term and a long term is good to have too.
Mm-hmm. Good job. So they need to be measurable, right? How else will we know that we have met that outcome, right? So it has to be measurable. It has to be realistic, right? We have to be the patient or the client has to be able to attain the goal based on their condition, based on their desire to meet the goal, right? So you're not going to have a patient that came in and had a knee replacement tomorrow and they're not going to be running a marathon by Friday, right? So they have to be realistic, they have to be measurable, and they have to be time referenced. And that's another thing. So we can have short-term goals and we can have long-term goals. Short-term goals can be within the hour or they can be within by the end of the shift, right? It just depends on what's going on with our clients. Um, Nursing diagnoses. Okay. So, how many parts are there to a nursing diagnosis?
The diagnosis and then related to, or um, like we can't put an actual diagnosis. It's just putting like, I don't know, I'm trying to explain it, but
Okay, so there's three parts, right? So you have your diagnoses, your NANDA, related to and as evidenced by, right? So except for risk diagnosis. A risk diagnosis only has two parts, right? Because with a risk diagnosis, it hasn't actually occurred yet, right? So we have are related to, but we don't have any evidence, right? Because it's not happened yet. So, like, you know, most people are fall risks when they go into the hospital. Let's just say, right, you're a fall risk. Risk for fall is related to use of, um, what do you call it? Opioid medications, right? Maybe they're on morphine or Percocet or something like that. They haven't fallen yet, right? But because of the medication, they're at risk for fall. So we don't have the evidence for that. Um, so I have an example of a nursing diagnosis. I will share my screen. All right, so here we have altered nutrition, eating less than the body needs. All right. Nursing problem, he is only eating 5% of each meal related to loss of appetite and weakness. All right, so our outcome here is the client will eat 1,500 calories of ground foods and drink 2,000 mLs of liquids during each 24-hour period by day 10. All right. And then our interventions. So interventions, we're going to provide 6 small ground meals at 8, 10, noon, 2, 4, and 6. The client will be seated in an easy chair with minimal assistance, encourage self-feeding, assist only if needed. And then for fluids, excuse me, we're going to offer 240 mLs of liquids at 6, 9, 11, 1, 3, 5, 7, and 9. Varied choices. He likes Jello or she likes Jello. Ice cream, 7 Up, chocolate milk, and pineapple juice. Drinks herbal tea with meals. Okay, so that would be some of our interventions. All right, so data collection. We're going to check their intake. Um, you know, how much um, we're going to look at the amount and type of liquid in milliliters, right? How much fluid are they taking? And then how much food are they eating at each meal, right? That's going to give us how well are they meeting those goals. Outcome, the client will eat 1,500 calories of chopped foods and drink 2,000 mLs of fluids during each 24-hour period. And then by day 10, the client was able to consume 1,500 calories in ground meals and 1,600 mLs of liquids during a 24-hour period. So we got the calories of food, right? We have not met our liquid goal though, right? So we had a goal of 2,000 and we are at 1,600. So what do we do? So if I didn't meet my goal, what do we do?
I'll go back and reevaluate.
Go back and reevaluate. What
Make a
can
new
we?
plan. We're gonna
Very
make a new
good.
plan.
Very good. So what can we do, right? That's exactly what we're gonna do. We're gonna go back and we're gonna look and see, all right, so that didn't work. What are some other things that we can do to help increase their fluid intake? Good job. Oops. So NANDA International, it's just a systemized taxonomy used to determine client concerns. Um, and so um, we also have NIC, which is your nursing interventions classifications. It's a way of identifying standardized nursing interventions. So I don't know how many of you have looked at any of the standardized care plans, have access to, some of the EMR charts and stuff. But like even in long-term care, for example, when we open a care plan and we choose a nursing diagnosis, it's going to generate a list of potential interventions that we can identify for our clients. The NOC, which is your nursing outcomes classification, that's a system for measuring client outcomes as a result of the nursing interventions. And so again, remember the RN has the final decision on nursing diagnoses, the choice of nursing interventions, and then the measuring the desired client outcomes. So this is kind of what I was saying. So you have in your EMRs, which is your electronic medical records, the care plans, depending on the EMR that you're using and where you're working. A lot of times, some of your nursing diagnoses will be generated based off of the client's nursing or the medical diagnoses, right? And so as you're entering the information into the chart, and the medical diagnoses are entered, a lot of times nursing diagnoses will be populated as well. So we have different types of care plans. So a standardized care plan is kind of what I said. So you're putting the information in and the care plan is being generated according to the diagnoses that you're putting in. And just like I said here, right, there is standardized nursing interventions as well that are going to be linked to that nursing diagnoses. All right, so these are standardized diagnoses. These are standardized care plans, okay? They're pretty generic, okay? An individualized care plan is tailored to meet the specific needs and the goals of the client. So you're going to take that standardized care plan and then you're going to individualize it to your client. Not every intervention is going under that standardized care plan is going to be appropriate for your client. All right. And there's lots of different factors that can play a part in that: age, physical ability, functionality, whatever it is. So we're going to individualize it. So we're going to make it our clients or our patients' care plan. Um, if a standardized care plan is used, again, the ones that don't apply, we're just going to cross those off, and we can also add interventions should we need to. But standardized care plans have their place in the world. But in order to truly benefit our clients, we need to make that standard. We need to take that standardized care plan and individualize it to our clients. Um, there's also multidisciplinary care plans. And that's where you have, different professions and disciplines that are working with the client. So you may have dietary interventions, you might have physical therapy, respiratory therapy, occupational speech, all of those things may be part of that multidisciplinary care plan. And I will tell you, somebody that has worked in long-term care, that most of the care plans that you will see working in long-term care and even in the hospital are going to be multidisciplinary because you're going to have different members of the healthcare team that are going to be working with your clients, right? It's not just nursing. We do a lot, right? But it's not just nursing that works with these clients. And so the care plan is something that helps to bring everything together. It's a way to help communicate with other members of other nurses, even other members of the healthcare team. And everybody is kind of involved in that plan of care. And so go back into the day, back in the day, these were all handwritten. And so I thought it was really, I told you my mom was a nurse as well. Um, and when she was going to nursing school, I remember her care plans, because this was back before computers and all that wonderful stuff. And you know how they have those legal paper, the legal sheets of paper, which I don't know what, but they're like really long. Um, they would print those out for them. And so her care plans were like 12, 14 pages long. I wish I had saved some just to keep them for nostalgia, I guess. Got a lot better. Whereas when I went to nursing school, they were still pretty long, but not as bad. And then, of course, when I started teaching, everything was computerized, so it made it a lot better, a lot easier to kind of, go through. Um, so, all right. So let's see. Let's do a recap. So let me think. Um, all right, what is critical thinking? What's critical thinking? Or what do we, all right, I'll ask a different way. What do we use critical thinking for?
Use critical thinking to make judgments based on the facts that we have.
Okay, that was a good one. Yep. I mean, use it to make judgments based off the facts, right? We use it to resolve problems, right? Find ways to improve a situation. It involves collecting, analyzing data, right? To make that decision, right? How can we do this better? How can we help the client achieve the highest quality outcome? What resources do we need? right? That's all part of your critical thinking. Um, what are some factors that can influence critical thinking?
Your upbringing and background.
Absolutely, your upbringing, your background. What else?
Trainings and things you've
Motivation,
been taught through.
attitude.
Okay.
Your
Your
attitude.
problem solving,
Attitude.
Your attitude, problem
communication.
solving, all of that.
You said
Perfect.
anxiety.
Anxiety. I love the way it's you remember that. um, Yep, all of that, right? Your age, your past experiences, your communication skills, what else? Your self-confidence, right? All of those things can influence critical thinking. And good job. All right, let's see, I'm trying to think of what else did we talk about. Um, Oh, we talked about the oh my gosh, nursing. We talked about oh my gosh, what is it? We talked about the evolution of practical nursing. All right, so what were the initial phrases that were used to describe the LPN scope of practice? There was four. Ooh.
Was one recognized,
Recognize was one, absolutely.
appraise,
Praise was
judgment.
another one. Good job.
Mm.
One begins with a J.
Judgment.
Judge.
Judge. Good job. And then
Okay.
the last one begins with a D.
Determine.
Determine.
Determine. All right. Good job. Yes. So judge, appraise, recognize, and determine. Those were the phrases that were initially under the U.S. Department of Vocational Education that described the LPN scope of practice. Good job. In the also the U.S. Department of Vocational Education also is the one that differentiated the task roles, right, between the LPNs and the RNs. Good job. That was awesome. Um, all right. Which parts of the nursing process can LPNs work independently in?
Data collection and implementation.
Data collection and implementation. Very good. Remember that RNs can do all five phases of the nursing process. And then LPNs can work independently with data collection and implementation. And then they work collaboratively with the RN for your nursing diagnosis, your planning, and your evaluation. Again, during the assessment phase, we're gathering data, which is your subjective and your objective. We're also verifying the data, right? That's comparing it if we need to their chart or something else. Um, your goals, even though I know like us, you're going to work in conjunction with the RN, goals must be realistic, they must be measurable, and they must be time referenced. All right. So really important with the goals that we have all three of those parts. And then we talked about the different types of care plans. So your standardized, your individualized, your multidisciplinary. And like I said, standardized care plans, they have a place in this world, okay? It's research based, just like anything else is, and it's the best possible options. But then the individualized care plan is really tailored for the specific needs of an individualized client, right? And that is the goal with our plan of care, right? It's supposed to revolve, our client's supposed to be at the center of that plan. So we want to make sure that we tailor that specifically to meet their needs and goals of that individual client. All right. Um, any questions about today, moving forward? So just some information. So I did get a list. So I got, did write down your names that told me that you already had your live reviews scheduled. I do have that from the online dean as well. So you will, not be docked for your time. I mean, you'll still be docked for your time, but it'll be excused because you need to um, attend those live reviews. And if anybody gets any other dates, please reach out to me and let me know.
So are you going to
Um,
record the class for us then, or what, how do
Classes
we?
will always, absolutely, classes will always be recorded. The recording will be posted as soon as it processes. So what I do is once class is done, I will actually convert it into a YouTube, and then send you the link to my YouTube. So that, because what happened eventually, Zoom will, and it's like 6 months, but still. So I put it on YouTube and then I will send you the link to that. So you will always have access to the recording. And then, like I said, should you need any other additional help, resources, tutoring, whatever it is, I have my office hours on Tuesdays and Wednesdays. All right. If those times again don't work for you, send me an email, shoot me a text, whatever it is you need to do. Um, and we can set something up so that I make, you don't feel like you're, out in the wind or anything like that. Okay. So don't ever feel like that. I'm here for you guys, to help you, guide you, tutor you, whatever it is that I need to do, on my part. And you guys, you do your part, I'll do my part. Um, what else? Forgot what I was gonna say. All right, so all right, all your dates are in Canvas. So for this week, all right, so I know I posted this in your announcements. For this week, for week 1, all right, you have chapters 4, 5, and 12. You have your adaptive quiz practice. And then next week, you will have your first lesson in your first adaptive quiz that will be due. I will be working on the groups for the team project. And then I will post those in the announcements as well. This way you will have them. There were need to check on a couple people just because they weren't in class today. So I'm not sure if there's going to be any more changes. But I will check on, there's a couple of people I need to check on. And then as soon as I find out that answer, I will break you guys up into groups, so that you have what you need to decide what topic you want. Um, all right. Any other questions? All right. Well, it's been a pleasure. I look forward to working with you throughout the rest of the term. If you guys need anything, please feel free to reach out. But I hope everybody has a safe and productive week, and I will see everybody on Monday morning.
See you later.